Good evening, everyone. This is Dr. Brett Pearce, and this evening I would like to talk with you about a little bit of a tough subject. However, it's a very important subject and one that I spend a lot of time at my work, happily, talking with parents and other professionals and teachers and pediatricians about. And that is the subject of depression and anxiety in kids. And believe it or not, depression and anxiety in kids are the cold and the flu of the mental health world, just like they are for adults. But for some reason, we easily seem to forget that. So, if you're new to my channel, this is Dr. Brett Pearce, child psychologist. Please do feel free to subscribe if you're liking what you hear and see thus far. It really does help out the channel. If you're one of my subscribers or a returning viewer, thank you so much for coming back. So let's dive right in. Depression and anxiety, they are common mental health concerns and things that adult mental health professionals, even, physicians, help adults with all the time. However, with kids, particularly with boys, there seems to be a lot of confusion out there. And childhood anxiety problems and mood problems are very frequently misunderstood, misdiagnosed, overlooked. There's even research, I couldn't really find an exact reference, but there was research that came out a while ago, 6 or 7 years ago at this point, that indicated that most, or not most, but a lot of the time, I guess, when we start to go, oh, the kid has oppositional defiant disorder, the kid has ADHD, really what we're looking at is a kid with mood and or anxiety problems, and the study indicated that we very frequently misdiagnose kids who have anxiety and depression. We view it as ADHD and oppositional defiant disorder in particular, when actually what's going on is that kiddo is struggling with depression and anxiety. And around here, I see that a lot. The scenario that I encounter very frequently is depressed and or anxious boy. Looks like we're gonna get a cat cameo. But what I'll very frequently see is a depressed or anxious boy. And sadly, what's often gone on is that kid has been really hurting and struggling for a long time. And then someone will diagnose the kid with just ADHD. And it'll be in circumstances, cat cameo, it'll be in circumstances where the depression really is pretty loud and kind of obvious. Like you'll have a kid who is having a lot of hopelessness. They're maybe even having thoughts of like, maybe if I just weren't here, then everything would be okay. They're kind of sad and angry all the time. And so those symptoms are very obviously about mood. I mean, I don't think many people would disagree with me about that. However, what you're also seeing with that kid is a lot of misbehaviors, a lot of explosiveness, maybe, school problems. And so there's a way where those things just kind of get interpreted on this level that seems to dismiss what I consider to be the true nature of those symptoms. And I also find it interesting just because I feel pretty convinced that if we took that same set of symptoms and we said it's a 28-year-old or an 18-year-old rather than an 8-year-old, that most people would absolutely go, oh, wow, poor guy's depressed. Let's treat him for depression. But for some reason with kids, we have a hard time, I think accepting, I guess would be the word, that kiddo could be dealing with depression. In fact, a lot of people seem convinced that kids can't really suffer with mental health concerns other than things like ADHD. And it's exactly, I think it's exactly the opposite, where you would likely find that depression and anxiety are a lot more common than ADHD. And even if you want to argue with me about which is more common, certainly depression and anxiety are very common in general. Sorry, bug in my throat tonight. And it's very, very important for us to be able to catch those things, because when you have a boy in particular who's really struggling with a lot of sadness or fear, depression and anxiety, and we just pop the kid on a stimulant and give him some accommodations at school, you can see how that really isn't going to address the problem, and in fact can encourage the kid to kind of avoid dealing with feelings, I think, sometimes. So some people ask me the question, why is it that depression and anxiety often get mistaken for something like oppositional defiant disorder, where you have a kid who's really angry, vindictive, conflict-oriented, resistant to authority, or ADHD, where the kid's really hyper, disorganized, distractible, executive functioning problems? And the reasons, I think, there's many. So with both depression and anxiety, you'll see a lot of emotional dysregulation. And that's a really kind of therapist-y way of saying kids' feelings get big real fast, real big real fast. Often in the form of anger, but not necessarily. It could be panic, it could be sadness, it could be a lot of different things, because when we feel really sad, it's easy to feel really angry. When we feel really scared, it's easy to feel really angry. And so there's a way where out there's just been this idea that if you have an explosive kid, if you have a kid whose feelings are all over the place, and so they freak out really easily when they're being disciplined, or when a limit's being set, or when things don't go as expected, they freak out and they can't handle it and their feelings go kaboom. I guess it's easy to interpret that as oppositional defiant. However, I've seen that diagnosis made with kids who are perfectly amicable outside of temper outbursts, or at least very, very amicable. Like they're just a treat to work with until they have a temper outburst. And what I struggle with is I go, well, how is this kid primarily oppositional? Like, how is that really the fundamental thing that's going on? Because it only happens when the kid's feelings are flying off the handle. And then inevitably you spot, signs that the kid is really nervous and really stress sensitive and really scared and or really sad a lot of the time. And then it starts to add up that we're looking at depression and anxiety. Furthermore, with both anxiety and depression, a certain level of irritability. I mean, in fact, in anxiety, it's not uncommon to see that in part of the diagnostic criteria, at least for one of the big, most common anxiety diagnoses, which is called generalized anxiety disorder. So you will see irritability frequently, which is to say, kiddo's grouchy. Same thing with depression, particularly for boys. Us guys, when we're feeling really sad or down, we can show it in a real obvious, like, I'm sad and down kind of way. But it's not necessarily that socially acceptable for many men to show that kind of vulnerability. And so very often mood symptoms can be represented by a lot of anger with men. And so what can be viewed as defiance, and may well be defiance in a sense, is often a lot more about sadness and fear than it really is about just I'm conflict oriented and oppositional. As far as ADHD, poor concentration is a part of the diagnostic criteria for at least one of the major depressive disorders, and one's mind going blank is a part of the diagnostic criteria for one of the most common anxiety disorders. If you're really, really anxious, which is to say you get really scared a lot, what you're going to do is you're going to be up in your head kind of stewing. You're just going to kind of be going over and over and over stuff that makes you feel anxious in your head over and over and over again. And so, if anything, it's almost like your problem is you're way too focused on things that make you feel nervous or anxious. And it's very difficult when you're that convinced that a natural disaster is going to happen and going to destroy your home and hurt your family, and you're seeing that happening and you're terrified of it. It's really, really, really difficult to prioritize other tasks like homework and things like that. Really difficult. And in fact, when your adrenaline is too bad, it starts to mess with your fine motor coordination, and it starts to mess with your ability to do more abstract thinking if your adrenaline goes too much. So same thing with depression. You can have low motivation, poor concentration. you can easily just kind of stop trying because why bother? Everything's crappy anyway, right? And so you could see how those symptoms are easily they could be misinterpreted as ADHD. And in fact, I worked for an ADHD clinic for 2 years, where I got a lot of lovely training and exposure, more so than I already had, to ADHD. And at that ADHD clinic, we very commonly only diagnosed ADHD in the negative, which is to say, we would always carefully rule out other potential causes for the symptoms, especially depression and anxiety. And in fact, like when I was training a graduate student there who worked under me, I more or less would grill him like, okay, well, what else, have you ruled out anxiety and depression? And don't talk with me about an ADHD diagnosis until we've ruled it out. So basically what I'm here to say is that it's just important for us to remember that kids have sadness and fear just the same way as adults. And in fact, in many ways, they're more vulnerable to it because they don't have the experience and the development to be able to handle it as well. And what can be really kind of mysterious is that kids can get really sad and anxious over things that us adults would just be like, who in the world's going to get that sad or anxious over it? And that's just because kiddos' experience and perspective might be sort of like this, whereas ours is like this. And so something that's this big to us is not a big deal, but to a kid, it's big. It has a big effect on them. So I just encourage folks, anyone listening to this video, be you a parent or a professional, just to be on the lookout. And whenever you have a kid who's struggling and you're wondering about what's going on, I'm not saying it's guaranteed by any means that it's anxiety or depression. ADHD exists, absolutely. ODD exists. I think it's very much overdiagnosed, but it exists. And it's just good to always think, is this kid anxious or depressed? And if you're seeing very classic signs of, say, depression, like hopelessness, like a feeling of, I don't want to be here anymore, like a real overinvestment in negative emotions, then, that's a mood symptom to me. Or at least it's very likely a mood symptom. And try not to just brush past it, because it's just really, really important that kids who have depression and anxiety get the help that they need, just in the same way it's important for adults to do the same. So, thank you for listening. Not the most pleasant subject on planet Earth. It's not fun to hear that kids can deal with anxiety and depression just like adults, but it's true. So thank you for listening and for your consideration. Please do subscribe by clicking a button down there. It really helps out the channel. Give me a thumbs up if you liked the content of this video. Smash that bell notification down there so you can be notified when my next video goes live. Otherwise, this is Dr. Brett Pearce, child psychologist, signing off.